Okay. So, first of all, thank you everybody for joining us tonight. My name is Donna. I'm with Genesis Fertility. With us tonight is Lauren Fortuna of Fortuna Acupuncture. They're located in Staten Island, New York. Lauren is a licensed acupuncturist who utilizes both traditional Chinese medicine as well as classical acupuncture. Without further delay, I am going to turn the controls over to Lauren. So,
Great. Thank you so much. I just wanted to say hello. Thank you, everybody, for coming in to join this discussion. And I'm happy to share with you some of my experience and insights with acupuncture for many things, but specifically with fertility and pregnancy. As Donna mentioned, my office is located in Staten Island. I have been an acupuncturist for over 20 years here, and women's wellness became kind of a point of passion for me, of wanting to really be able to help in this area and this department. So I'm going to begin my slideshow presentation and just go over a little bit of information about acupuncture in general, and then go a little bit more specifically in how acupuncture helps with fertility. So let me just bring that up. Okay. Well, you all got this. This is my website in case anybody would like any more information. It'll be there at the end of the presentation as well. So I like to say ancient wisdom for today's wellness, right? So acupuncture is an ancient form of traditional Chinese medicine, and it dates back over 3,000 years. The whole idea of acupuncture is that it's focusing on the restoration and the balance of the body's energy, or as we like to call it, qi. There are different signs and symptoms that can occur for a person, and depending on where there is a disruption in that flow of energy or that flow of qi. So by stimulating various acupuncture points, that helps to kind of smooth out that flow of qi, reestablish it to be able to go along the pathways or the meridians, right? And this helps to stimulate circulation to the organs, the glands, the different tissues of the body. So that is the Chinese medicine perspective of things. What does that mean in Western medicine, right? So, as I stated before, so there is a physiological response once an acupuncture needle is stimulated. So I do it with the use of tiny, sterile, thin acupuncture needles. You can also help stimulate the points via massage, acupressure. You could use essential oils. So there's a bunch of different ways that people are able to help tap into their body's potential, right? So the acupuncture points can help stimulate specific nerve fibers, and these nerve fibers are going to send signals back to the brain, and it's going to help influence the autonomic nervous system, right? So acupuncture can help with releasing a variety of chemicals and hormones and neurotransmitters, right? So some that you might be familiar with is endorphin release. So that helps to relieve pain. It helps to create a sense of well-being and relaxation. So this is part of acupuncture's contribution to its stress-reducing effects. It can also influence serotonin and dopamine. So these things also help to regulate your mood, regulate your sleep, your appetite. As many of my patients comment on, in the midst of a treatment, their stomachs will start grumbling, and it's just a way that, we have the qi flowing and activation is happening. So those are just a couple of examples of how acupuncture can have this physiological response in the body. What I want to focus on more is how the acupuncture can help with the endocrine system. So it can help deal with hormone imbalances. Stress response is going to be, cortisol levels. It could be thyroid issues, and specifically reproductive hormones. And that is the beginning of how we want to go into acupuncture for fertility. So when anybody is coming in for a treatment with me, some of the things to expect is during the time we will have a consultation. So during that, we will go over and review some of your medical health and history. So I want to take a look at kind of the whole system. I'm not just treating the person, I'm not just treating the symptoms, I want to treat the whole person. So, that whole idea of body, mind, and spirit, it's not just a good catchphrase, it's actually really pertinent to this. You can tell that when you have a stress response, or if you feel upset by something, you can have a physical response to that as well. So, these things can interact with each other. So during my consultation, my intake, I like to speak to patients about their nutrition, their diet, about their digestion, about their sleeping habits and patterns, how their stress is and how they respond and deal with stress in their everyday situations. Of course, dealing with fertility, we're looking at the gynecological issues as well. If there's any issues with that, we want to take a look and, see what it is that I can specifically work with. Regards to IVF, we're also going to take a look, or with assisted reproductive technology, just to see what previous treatments people have had. I also like to help encourage my patients to become, I like to say, active participants in their health, right? So my job is helping you, via acupuncture, but everybody knows that they get sent home with some homework. So, we want to discuss, like I said, changes for emotional, physical well-being. So we go over some basic nutrition, ideas for mindfulness and meditation, and movement. These are all parts of the puzzle for everyone to kind of feel their best in their daily lives. So this is some of the treatment tools for acupuncture. So on the left, you'll see that there are the acupuncture needles. So, excuse me, like I said, they're tiny, hair-thin, disposable stainless steel needles. Just use an alcohol pad to whack down where the points are going to be, and then insert the needles from there. It's not painful. That is my number one question for people is this going to hurt? And no, it doesn't hurt. Many of my patients will testify that they take really good naps during the sessions. So the needle is, like I said, hair thin. It might feel like a little bit of a pinch, like a mosquito bite. Other than that, it's nothing uncomfortable. And everybody, like I said, feels pretty relaxed and calm throughout. In the middle, you see something called moxibustion. So that's an herb called mugwort. And there are different forms of it, but I tend to use, as you see in the picture, it looks like a cigarette. So you light the end of it and you can hold it over the acupuncture points. And that helps to, again, build blood, warm the meridians and warm the acupuncture points. Something else that I tend to use in my practice is something called cupping. So you see those little glass cups there. So it helps to make a vacuum against the skin. And it feels almost like a reverse massage, where a massage would be putting pressure down to help alleviate muscle tension and pain, where cupping is doing the opposite. So it's lifting up and it's trying to create space in the fascia to increase blood flow to the area and bring more blood, bring more oxygen to those areas. So some of the common issues that patients come in to treat can include PMS. So you have headaches, you can have irritability, low back pain, breast tenderness, things like that. And it can occur, a few days to a week before your period starts. Some people come in with irregular menstruation that, their cycle, instead of being 28 to 30 days, might end up being 35 or 40 days. So when dealing with fertility, we want to try to rein that back in and get it back to a quote unquote normal cycle. That said, there is a variety of days for normalcy. Some people are 25, some are 28, some are 30, but we want it to be consistent, whichever it is. A lot of people do come in for painful periods, so they get a lot of cramping and pain during their cycle. Another question I get asked is, is it okay to come in when I have my period? And I say, yes, absolutely. It's one of the better times to come in if, in particular, one of your issues is having painful periods. I've had, like I said, a number of patients who felt pretty bad when they came in, and after laying on the table and having their treatment, their cramping had went away and their periods were much better after that. Another thing to help work with is the idea of irregular ovulation. So sometimes women are skipping it altogether. Sometimes it is happening too late in the cycle. So like I said, we want to get an idea of if that is something that's happening and then try to help regulate that. So just continuing down the line, PCOS, high FSH, diminished ovarian reserve. So these are, again, some of the issues that women come in to help alleviate with acupuncture. So again, how acupuncture can help, I stated some of these. We are, again, regulating the ovulation and the menstrual cycle. So the other aspect with fertility is that it's important to help improve ovarian function, right? So how do we do that? So we're trying to increase blood circulation to the ovaries. That way we can have better follicle growth and development, better egg quality. We're going to, again, in that part, regulate hormones and increase circulation, which I just had mentioned, just to help with increasing the follicle size and the count. When we're moving forward with things, menstruation, ovulation, and then preparing for implantation via either naturally or with IUIs or IVF. You want to help increase circulation to the uterus. So we want to help make sure the endometrial lining is nice and thick. Through all of that, we want to relieve cortisol. We want to help keep everybody as calm, cool, and comfortable and relaxed as everything that's going on, with everything that's going on, excuse me. Women aren't the only ones who can benefit from acupuncture. I do have a number of male clients who come in as well, because it takes two to get this whole baby thing going, right? So there are male factors contributing to infertility as well, whether it's an issue with morphology, with motility, low sperm count. So again, there are acupuncture points to use to help, again, increase blood flow to the area, help regulate sperm and improve quality of that as well. Okay. So, course of treatments. Another common question for everybody, because they, you want to know, how long do you need to do this? Acupuncture in itself is something that you work on to build up, right? So ideally, in the perfect scenario, I would have a patient come in 2 to 3 months before they're going to start IUI or IVF. This gives us a decent amount of time to help have an effect on egg quality, to help regulate any of the issues that were previously mentioned. Like I said, if there's irregular menstruation, irregular ovulation, dealing with blood issues so a lot of people have low blood counts, are anemic. So we want to increase blood in that way as well. Once a person starts their cycle, starting with their period. So again, I'll back up. Depending on where you are in your menstrual cycle will help to dictate what it is that we're working with, right? So if, again, you have your period, then at point in time, okay, we want to move blood. We want to help make sure that period is nice and easy as it can be, help get rid of the old blood. The back end of that is we also want to help nourish and strengthen, right? So you're having this blood loss happen, and we want to help kind of rebuild your resources. Again, if you're trying naturally, or if you're doing IUI or IVF, the next stage in that is dealing with ovulation, so preparing with that. So we want to help with the stimulation medications would be doing. So it's, again, increasing the blood flow to the ovaries. We want as much blood flow, we want as much oxygen, we want as much nutrients going to the follicles and to the eggs to help increase their size, increase the number that someone is having. Once someone goes in for their either IUI or retrieval, then after that, we're dealing with the lower aspect. So we're dealing with the uterus. So acupuncture treatments after that are going to be dealing with thickening the endometrial lining, again, increasing blood flow. This is a common theme for everything with fertility and acupuncture. If a patient is moving forward with IVF as opposed to IUI, we're going to be doing some specific points for that before the transfer. I like to see patients either the morning of or the afternoon before their transfer. So there are acupuncture points that help with dilating the cervix to make the transfer go easier, to help relax the uterus, to make sure there aren't any contractions or anything happening like that. We want to keep everything calm, placid, nice and relaxed, and also keep the patient relaxed. Stress is probably, one of the larger issues for women dealing with IVF. There's a lot going on that's out of their control, it feels like. So that is why I, again, focus with patients in dealing with, meditation, mindfulness, nutrition, exercise. So these are the things that they have control over, right? So if you can kind of focus on doing the best you can in those areas while you're doing IVF, you know that you did your best, you did your homework, you did things that you can have a direct impact on. Once we finish with that, so again, the treatment would be before the transfer and after the transfer. And in general, like I said, I should have said this at the beginning, I usually see patients on a weekly basis. So once the transfer is complete and we find out in that 10 to 14 day period if it is a successful transfer, we continue with our pregnancy care. So I, again, try to continue with the weekly sessions throughout the first trimester, because that seems to be the highest rate of miscarriage at that point in time. So again, we're going back to focus on blood nourishment and strengthening, increasing, again, the circulation to the uterus, make sure that lining stays nice and thick, full of oxygenated blood, make it a real nice, happy place for that embryo to say, yes, this is where I'm going to stay. Some of the other points are uplifting, again, with the whole idea of preventing miscarriage and calming to keep everybody just nice, calm, cool, and collected through all of it. There are particular points to do at the 12 and 24 week marks. So these are our transitions between the trimesters. And again, if anything pops up that women need to deal with, whether it be nausea or back pain or headaches, bloating, high blood pressure, there's a myriad of symptoms which can pop up through pregnancy. So acupuncture is a safe and effective way to help deal with some of those issues. Once a patient hits 38, 39 weeks, then we turn the tables a little bit and do our points to prepare for labor. So the whole time leading up to that, we're telling the body to hold on and to lift up and to stay there. And at this point in time, at 38, 39 weeks, we do the opposite and say, okay, you can relax, you can let go. Try to help things open up a little bit and get everybody ready for the main event of delivery. I do see patients after delivery, so there is postnatal care. Some of it is just general, relaxation, strengthening again as well. There is going to be some blood loss happening, so we want to help with recovery, with building blood. For those who are deciding to breastfeed, then there are points to do to, again, help with increasing milk production and making things a little bit more smooth with that. It's also, the hour of time that someone gets to kind of leave everything else behind and come in and forget the outside world for a little bit and be a nice little calm oasis for them. So people do enjoy that. And I hope I didn't go too quickly, but I think that kind of sums up everything that I had wanted to go over. Again, my website is up. If you ever have any questions, you can give me a call. You can visit my website. I do have some more information there. And yeah, I'm happy to help and answer any more questions.